the percentage of health problems related to what they call non-life modifiable. Okay, your gender, your age, your race, ethnicity, low birth weight, any kind of genetic predisposition. Those are called non-modifiable. You can't change those. Those you come into the world with, all right? So you can't change those. The thought is, however, when you can do a whole lot of changing of the modifiable behaviors, the smoking, the poor diet, the physical inactivity, and once again, physical inactivity, I would want in my neighborhood if my neighborhood was safe. Thank you. Okay. All right. So there's that issue, right? Right. Now you got to get out there and want. In my neighborhood, can we talk about that? Okay. Body fat distribution, illicit drug use, excessive alcohol consumption. I know y'all like a little taster. Once I talk about excessive alcohol consumption. Don't talk about my mind. Excessive alcohol consumption. Not little taste. You got to go that way. All right, that's fine. All right. But those are the individual factors. And the point that I wanted to make is that increasingly these that we can change, allegedly, they're constrained by social factors, cultural context, lists about food, survival, health, faith in healthcare, the neighborhood effects, the safety, the abandoned houses, the physical environment, the social networks, I've been doing some clinical work, and it's just really, really sad to see all the strange family networks that happen in lots and lots of families of color and of race. I don't want my family to know. The last people I want to help me with is my family because of X and Y and Z. Okay? So there's family absence, and I kind of put down baby, mama, daddy. That does happen. Okay, so there's that. It's got a nice beat to it. Okay.
Sorry about that.
That's all right. That's all right. All right, and then you got the structural factors. And as I started looking at this morning, I said, there's a lot more structural factors. Since I kind of first put this thing together back about 3 years ago, there's a demographic change, people moving in and out of neighborhoods, male to female ratio, there's employment and labor, huge. Since 1960, 9% reduction in businesses in the city of Detroit. Sorry, that's huge, That's really huge. That means that we can't get jobs. And what do we know about health insurance and healthcare access? Those have always been tied to what in the U.S., and in Detroit in particular? You have a job, you have health care if you have a job. You don't have a job, you don't have. Okay, so when you have this reduction of jobs, guess what? A lot of people no longer have health care, because we don't have universal health care, except in very, very time-rich situations, all right? Civil service employment, that's gone. That is so gone, So we don't have that. There's this job education mismatch, right? They'll talk about green jobs, they'll talk about technology jobs, but they'll say, but your education, you don't teach any of those. If you have any schools that are still around, because of the school takeover by DPS, people leaving the schools in droves, school closure, but also the elimination of school-based health clinics, and that was once seen as, look, health clinics, you at least can get health care for the kids and sometimes the family completely free of charge. So that was always seen as a kind of last-ditch Hail Mary. We at least have school-based health clinics. And they have the kind of funding, so they'll always be there for us. Well, those are gone too. Those are gone as well. We can talk, as Omo probably does, about structural violence and discrimination that continues to be there. Legal structure, law enforcement, incarceration patterns. Skill and Foundation and others are saying, listen, help us change the discussion so that when we talk about safety, it's not using incarceration as the only solution to safety, but other alternatives to incarceration. Because right now, there's a real simple equation that's kind of being thrown out there about how you accomplish safety. And you accomplish safety by locking up lots and lots of black and brown people, and lots and lots of Muslim people that have a difference. That's the solution. That is to turn around. The policy environment is also an issue, as well as municipal resources. No public health officials, no health department, and elimination of accountability. So a lot of challenges here. Structural factors. Yep.
on the legal incarceration issue.
Yeah.
Now our society have been locking up people for the beginning of time, and they see it's not working. And you're a smart man. You see it. You saying the same thing.
Mm-hmm.
Why haven't they changed the trend of just saying let's lock them up? Don't give them no education.
Mm-hmm.
But what's the outcome? Lock them up, right?
Yep. And why is that? Who benefits? Who benefits? Okay. Qui bono in Latin. It's always kind of a policy. Follow the money. So if you want to know why, follow the money. And there's so much money in private incarceration and privatizing correctional facilities. I mean, that's a huge, huge growth industry and so forth. The industry's going to be kind of pushing it away, but there's always crumbling. Okay, so that's why. We talk about people who stand to gain from the status quo, and those we have to challenge as well too. So that's real simple, real direct answer. Follow the money. Unfortunately, in the U.S., the money never lies. So you follow the money, who benefits from it? It's like, oh, okay, that's real simple. We understand why. We understand why. So that's it. Now, the other thing that I wanted to talk a little bit about, and we've already done this, and I'm going to kind of go ahead and look at the action piece in a moment, is